but thank you. Now I'd like to just throw the chat open to any questions that you have that have come out of the presentations that we've seen so far, and if there's anything you want any further detail on. You're all still muted, so I don't think you can unmute, but very happy if you put something in the chat, or if you raise your hand, then we can try and make sure you're... Oh, Alex, you can unmute yourself. Excellent.
I was only doing it to see if it could be done, not because I have any question to ask.
Okay, well, there's a few of us trying to keep an eye on the screen, so we'll try and monitor anything there. But if you've got any questions, then please do let us know, and we will try and pick them up now before we move on. Douglas, yes.
Hi there. Hi, I was really interested in the public health guy, Matt, I think his name was, who presented. One of the questions that I have with regards to this is the use of the term BAME. There's quite a lot of controversy over that term at the moment. I'm just wondering whether we are going to carry on using that term in the future.
Hi, Douglas. Thanks for the question. Yeah, interesting you said that. Actually, there has been some initial conversations. I know nationally there's not really one settled kind of term to use, and that's one that's stuck. But I think there's a bit of a move to use ethnic minorities as a more appropriate term. And I know Community United, who are on this call, we've had some discussions with them about kind of whether we can agree on a terminology going forward. So yeah, I think it's a good point raised. I think it's something that we have already started to discuss, and hopefully we can think about that. Kamal, I see Kamal's got her hand up. So
I was going to say, as a member of that group, I probably would like to join in the conversation to say what we called, because I don't refer to myself as a BAME person. So very happy to have that conversation for West Berkshire, and hopefully we'll be able to do that. So I'll just give my colleagues a plug. They've got an event next week, and I'll try and share some information about it following our event. Raymond, you've got a question. I hope you've been unmuted.
Yes, can you hear me?
Yes, we can.
Hi, again, it's for Matt. I just noticed on your favourite chart that you mentioned where you highlighted that health was a small overall proportion to the well-being of someone. I think I understand why you said that, and in the context of the graph I can appreciate that, but I think if someone is suffering from serious conditions, that chart is completely upside down, and health is all the contributory factor to health and well-being. If you're not well, then everything else is out of the window largely. So I just wanted to mention that. I don't know if you have a reaction to that.
No, I think that's a good point. And what I didn't want to come across as saying that the NHS isn't important. It absolutely is. And like you say, we need it there when we do become poorly. I think what my point is that actually most of our health is shaped by particularly the first 1,000 days of our lives, in terms of whether you are brought up in a secure home, whether you have a safe, caring family, whether you have a job, whether you have good education. We know that actually in terms of prevention from a public health perspective, those are the things that very much shape our lives and whether we have good, healthy life expectancy and go on to live longer. So I think really that's kind of the point I'm trying to make, but absolutely it's not one or the other. I think we need a strong health and resilient system that supports the kind of conditions in which we grow up. So apologies if that came across the wrong way.
Thank you, Matt. Judy, you've got your hand up.
Yes, please. Can you hear me?
We can, yes.
Yeah. I've got another question for Matt. I think he's doing all the work today. I'm really interested in the local issues in relation to track and trace, and also in relation to testing. At the moment, those are essentially managed nationally. I have myself looked on the website, the government website, twice recently, because I have to have a test before going into hospital for an operation. Now, as far as I know, the hospital is going to provide that, but I was hoping I could do it locally because I'm going to Oxford. I have looked twice. Both times I was told that there were no tests available within reach of me. I've seen on Facebook people being sent to Aberdeen, and I drive past the testing site at Newbury at the showground quite often and see nobody going in and out. I can see as I drive past that the staff aren't doing anything. They are just sitting there. There are no cars inside, no evidence of anyone using it. It seems to me that the local track and trace isn't being used effectively through the current system, because people who are track and tracing aren't necessarily local. I think we could be much more effective locally than doing it through a national system. What would Matt feel? Would it be better if everything, all that was devolved to the local area? Because I would like to see that local people can get local tests when they need them and appropriately.
Okay, thanks for the questions. A lot of questions in there, I think. I'll try. No, that's okay. That's okay. So the first one with regards to your specific circumstances in terms of getting a test before going into hospital, that at the moment is very much carried out by what we call Pillar 1. So that is our NHS lab testing facilities to do that. I get your point now in terms of the distance you have to travel to do that. At the moment, I'm not sure what there is in terms of the alternative, so I can take that away, Judy, and see how we can look at that. In terms of the testing capacity, I think the key thing for us to remember here, this is operated by the Department of Health and Social Care. And where, what's happening is the number of tests at the moment are being reprioritised to other parts of the country where there's higher incidence of COVID-19. So it's the challenge we've got is processing the actual swabs in the lab. That's where the problem sits at this moment in time. So where the testing station might be looking empty in West Berkshire, it's simply because there's not enough swabs to actually carry out, because in terms of they can't get processed at the laboratory at this moment in time. So we're working hard as we can with our national partners. This might last for a few weeks. I think the key messages for us is if people need a test, only if they have symptoms or they've been asked to by a health professional or another person. So that's really the key messages for us until we kind of resolve this national testing capacity issue. And then in terms of your point around localization of this work, that is very much the direction of travel in terms of contact tracing. So already the council are now looking into how we can train up individuals within the local authorities to support contact tracing going forward. Our contact tracing data is actually quite good for West Berkshire and better than most parts in the country. So about 4 in 5 people who have a positive test are being followed up. And about 4 or 5 of those contacts of those cases are also being followed up. So as I said, we are moving to a more locally derived system. And I think you're right. I think people on the ground locally know their communities. And we also, we can go on the door and knock on the door and support them as well. And that can complement our community support hub. So I'm hoping that answered most of your questions, but I'll definitely get back to you on your first point about NHS test.
Thank you, Matt.
Can I ask a supplementary on that?
Absolutely. I've got 2 other people, so
okay.
if you don't mind putting it in the chat. This is a big topic, as you will have seen from Newbury Weekly News today. And so I'm not trying to shut you from asking it. I just want to make sure I've got 2 other people with their hands up so that they can ask theirs. So Judy, please put it in the chat and we will follow this up. I've already flagged this with Matt, that this is a massive issue, and can we try and make sure that we're communicating with everybody about it. Verity, over to you.
Hi, can you hear me?
Yes, we can.
Yeah. Hi, it's more of a comment than a question. Among numerous other things, people may be aware I work part-time in a coffee shop in town, and the comment about COVID deepening inequalities locally, I mean, that is already happening. I think a lot of us who have nice, comfortable middle-class lives don't realise how precarious some people's lives are. I mean, the shop that I work in, our trade has drastically declined because office workers aren't in offices, shoppers aren't around as much, and there are a lot of people who are faced with extremely high rents locally, and people do not have any resources. I mean, I think among my work colleagues, probably only one other person actually has enough money to survive on for 3 months. And yeah, if people's lives are precarious already, and this is knocking people off, and potentially sectors like retail that could offer work opportunities to people entering the work market aren't going to be able to do that. And it's going to actually have a ripple effect that I think is going to deepen inequalities for quite a long time in the future. And I guess final comment is, this is exacerbated if you have people who have, for example, pre-existing health conditions, mental health issues, learning disabilities. You know, there's a cumulative effect. So I think we've got to face up to the fact that unless we do something now to tackle this, we are going to have an even more divided local area than we have already. That's it.
Thank you, Verity. There's quite a lot involved in that, and I'm not sure we're going to be able to unpick all of that. But there's a similar comment about unemployment and people out of education, and that has doubled. And what plans have we got to create opportunity for our young people? So if you don't mind, we'll take them offline and feed back to you afterwards, rather than trying to give a meaningful answer in very short time now.
Yeah. I mean, I would just say it's not just young people.
No.
I mean, we focus on young people and that's great, but actually there are a lot of older people who have immense barriers, homelessness, drug and alcohol issues.
Yeah. No,
health issues.
Around similar themes about employment and lifestyle and how people are going to live. And so if you don't mind, I would like to follow them up thoroughly rather than give you a cursory answer now. Andrew, you've got your hand up.
Yeah, it's just a quick piece of information following on from the sort of test and trace question. I'm Andrew from Healthwatch West Berks. We've raised the very same point Judy did with both the Chief Exec of Royal Berks and various other NHS committees. So, you know, what I'd urge people to do is, if you come across issues where things aren't quite working as well as they might, you know, get in touch with us and we will pass it on. It's not easy to solve this sort of thing because, as everyone's pointed out, this is the first time everyone's been in this position. And I think by working together and coming to events like today and feeding back and offering opinions, you know, some great stuff from Verity, intelligence like that, it's really, really important so that everybody can plan things and we can try and get better outcomes for all. But yeah, do keep giving the feedback. It really is important and it does get to the people that matter.
Definitely,
Thanks.
definitely. And I would say, as a chair of the engagement group, I'm just going to mention something. We used to be called PPE, which is called Patient and Public Engagement. Since COVID, that's not really a great name. So now we're called Health and Wellbeing Board Engagement Group. I have managed to get an email for us, so I will put that out at the end of the session. So if you've got any follow-up, anything that you want to raise, anything that we don't manage to cover today, very happy to hear from you, and you can share it as widely as you want. I'm just going to do one last call on questions if there's anything. If not, we've got a couple of things to show you before we get ready to move into the breakout groups. No? Okay. So Rob, could I ask you to queue up? Oh, hang on. Do I need to tell everybody about what we're doing in the breakout groups? Yeah, I can't remember. Okay, some of you will have selected a breakout group to join and attend. And at the beginning of this, we had said, at the beginning of all of this, trying to organise it, we had set a limit on it. So we have got some students on the line that are ready to join the workout group. So I am trying to move us along quickly to that. And you've got a facilitator and a scribe in there. So hit the video, go, Rob, please.